We sometimes hear that someone has been diagnosed with a certain type or stage of cancer, but unless you are a doctor or have been personally affected by cancer, you may not know what a stage means. Dr. Steven Steinberg of Boca Raton Regional Hospital joins us to explain much more on this. Thank you so much for joining us, Doctor. What does a stage of cancer mean?
Well, a stage, Mike, is a way of looking at a tumor, a cancer, with the idea of identifying characteristics that allow us to make predictions about what's likely to happen, and also to make decisions about what the appropriate treatment is for that tumor.
With that information, my next question, what are the different stages, and are they the same for all types of cancer?
So the most common staging algorithm for cancers is the TMN stage, and that's tumor, which is how big is the tumor, what are its relationships to nearby structures and blood vessels and things of that sort. The next part of it is N nodes, lymph nodes, which are the glands that are near these tumors and sometimes will have cancer within them. And so the next question is asked is, are they involved? And then lastly, there's the M, which is metastases. And as many people know, that is, has the tumor gotten to distant areas, such as perhaps the liver or the lung? And by understanding those characteristics, we can make predictions. But that staging criteria isn't applied to all tumors. Some tumors are better described by other definitions. And so for a particular tumor, you may not hear those words, you may hear others.
Okay, it's important to know this going to the doctor if you're faced with a diagnosis of cancer. You answered the question of how are cancer staged, but why is that important from a doctor's perspective, from a patient's perspective?
Well, I think the way in which they're staged has to do with things like CAT scans and MRIs and PET scans, which are ways of looking to see where and how the tumor is. We at Boca also have a new technology that's unique to our area, and that is endoscopic ultrasound, which is a way of applying ultrasound technology, like when somebody's pregnant, except it's a really tiny little chip that goes on the end of a scope, and it allows us to get near the tumor and to define the characteristics of it in ways that are beyond the accuracy and precision of other kinds of modalities. And so in this day and age, pretty much everybody with a lung cancer or a cancer of the esophagus or a stomach or a pancreas ought to have an endoscopic ultrasound staging procedure as a way of most accurately staging the degree of their tumor.
Catching it early, always key. Doctor.
Absolutely.
All right, Doctor, thank you so much for joining us. And Boca Raton Regional Hospital sponsors our expert and underwrites